Hello, welcome to my show. My name is Dr. Ofelia Villanueva. I'm a general dentist practicing in Quincy for at least 17 to 18 years now. I'm here again to show you my interview to our guest speaker for today, Dr. Alan Ali Nasseh. Before I introduce him to you, I would like to add you that I'm doing this show of mine in behalf of Academy of General Dentistry. Academy of General Dentistry is the second largest organization in the United States of America. And we're trying and we're advocating, you know, to tell the public that about the oral health care. And I'm doing all phases of dentistry so that the people will understand the meaning of all specialty in dentistry. And I would like to welcome, it's my privileges to welcome you, Dr. Alan Ali Nasseh.
Thank you, Dr. Villanueva. It's my pleasure to be here with you today and share with you and your viewers some of my experiences in endodontics and root canal therapy. Thank you for having me.
Yeah. Would you mind to tell me something about yourself so that the people, you know, will understand who you are? It's nice, you know?
Sure.
Where did you graduate? You know, when did you graduate? How long you been practicing here in America? You know?
Sure. I'm an endodontist, and I've been practicing endo for the past 15, 16 years. I graduated from Northwestern University Dental School in Chicago, and finished my postdoctoral endodontic program here at Harvard School of Dental Medicine, where I received a master's in medical sciences and did some research and so on. And then been on the faculty at Harvard Dental School for the past since 1997, and I've been practicing clinically here in the Back Bay area of Boston.
How long you been practicing again here in Boston?
I've been practicing in Boston since '97.
Wow.
But I was teaching also more frequently, and as well as working in the South Shore area as well. But now, since the past 10 years, I've been, for the most part, here in Boston, in the Back Bay area.
You have a beautiful office.
Thank you.
You know, as I said, I'm a general dentist in Quincy, and I've been practicing there for 17 years now. You know, and we're gonna show this interview mostly in the South Shore area.
Oh, terrific.
Okay, to the public, I would like to ask Dr. Nasseh the first question about root canal. Tell me about the root canal. You know, root canal I know because I'm a general dentist, you know, to save the tooth, to prolong the life of the tooth so that the people will use it longer, rather than pulling it and do something. So, can you tell me about root canal?
Sure. Root canal therapy is a procedure to preserve a tooth that would otherwise have to be extracted. Root canal itself is actually an anatomical space inside the root of the tooth. Root canal therapy is the procedure by which general dentists and endodontists that are specialists that do root canal therapy access this space, the root canal space, and remove its contents, whether it is pulp tissue and nerve or it is infected material. And then, as a result of that procedure, people are able to maintain their teeth and not lose a tooth. So it is a procedure that has been a great benefit to the public over the past 50, 60 years, whereas prior to that, we really had no option but to remove a tooth that was infected. And currently, with the technology that has come about over the past century, and specifically in the past 50 years, we have developed techniques that we can clean and disinfect a tooth that has become infected, and as a result, actually manage to save this tooth.
Oh yeah. How about, you know, why the people are so afraid of doing endodontic treatment? Maybe they're not so aware about that, you know, they can do root canal without any pain, or like painless dentistry.
Yes. Unfortunately, as I mentioned, it is a relatively old procedure. It has been developed over the past 50 to 100 years. And at that time, during that time period, in the early phases of root canal therapy, the importance of anesthesia and analgesia was really not as well known or not as emphasized as much as it should have been. As a result, there is a string of traumatized patients which understandably have grown to be afraid of this very helpful procedure. And however, I think advances in the techniques and technology, as well as our understanding of anesthesia and anesthesia techniques, by anesthesia I mean local anesthesia, you know, the Novocaine, the use of Novocaine and so on, has improved greatly over the past couple of decades, to the extent that performing root canal therapy is, and in my opinion, should be always completely painless at the time that the root canal is being done. Because having any pain during the root canal is really is a failure of anesthesia or local anesthesia. Now, there are times where afterwards there could be discomfort, and clearly many people that need root canals have pain to begin with. But the procedure time itself should always be painless, because administering the right amount of anesthesia is the key component of having a completely pain-free experience. And that, I think, it's a big pet peeve of mine. I teach anesthesia at this school as well as my lectures abroad. And I believe, and I'm passionately, I'm very passionate about the subject, that I believe it should be completely painless while it's being done.
Painless, yeah. Do you always put a Novocaine or like anesthesia every time you do a root canal?
Yes.
Every time? How about, I'm also a general dentist, so if the patient, you know, the tooth is dead, you did some testing, we called it electric pulse testing, to see if the nerve is dead or alive. And if it's dead, do you still put Novocaine to the tooth?
Yes, I believe
or you
that
open
every
it?
tooth should be anesthetized in the same way that the maximum amount of anesthesia is needed, because that's the only way you can guarantee the procedure to be painless. Even in a dead tooth, when a nerve is completely dead, there's been many incidences or studies have shown that the very end of the root, there could be a partial amount of nerve tissue that is alive. And patients could feel that, and that would be a very unpleasant experience. In order to have a completely pain-free experience, every tooth should be numb to the maximum level. And in fact, even one area, Dr. Villanueva, that people don't realize is that most people anesthetize a tooth for root canal therapy the same way they would anesthetize a tooth to perform a crown or a filling or any other procedure. However, studies have shown that you need the most amount of anesthesia to perform root canal therapy than any other procedure in dentistry, frankly. So, including surgery. In fact, you could put an implant in place with less anesthesia you need to do with a root canal. So, it is very important that proper anesthesia is administered with the right amount and at the right place and location, so people are completely numb. And that could be done using modern understanding of anesthetic technique delivery.
Yeah. Who normally perform root canal? You're a specialist, I'm a general dentist. Patient came to me complaining of pain. Who?
What I always say is the person who is qualified to perform the root canal therapy at the level of the standard of care. The standard of care, you know, at the level, and in my opinion, even beyond the standard of care. Clearly, most endodontics nationwide at the present time is done by general dentists. Endodontists are a small percentage of the dental population, if you will. And most access to endodontists is limited in many parts of the country. Therefore, most of root canals are done by general dentists, and general dentists are qualified to do most endodontic cases. Endodontists are specialists that have had further training, another extra 2 or 3 years in the area of root canal therapy and root canal surgery. However, as I mentioned, many teeth could be handled very effectively and efficiently by general dentists. And usually the general dentists are able to screen patients for the complexity level of the case and refer according to their needs.
Yeah, because I know not all general dentists are doing root canal.
Yes.
You know, as a general dentist, you know, you want to do what you want to do, like, you know, on your own convenience. Me, as a general dentist, I do root canal, a simple one. But we'll talk about later the surgical and the conventional, so that the public will know the meaning of simple, you know, root canal, or maybe more complicated one. And I would like to ask you, how many visits? I normally explain to the patients how many visits for the root canal. It's not like one time. I know some specialists, they do one time. And to me, I don't. But to you, being a specialist, I would like to know.
Yeah. Well, in our office at Microsurgical Endo, we perform most of the cases in a single visit. I believe that with proper efficiency and techniques, it is possible to do many of them in one visit. However, many cases cannot be done in a single visit, not only because of lack of time, but also because of the requirements of a given case, the degree of infection.
So you're talking about, sorry to interrupt
Yeah.
you, meaning the degree of the infection. So if you think if it's like just open accidentally, doing, you know, the restorative, or meaning doing filling and expose the nerve, then you can do a 1 day or 1 visit root canal.
Yes.
But how about if it's like, you know, I know the viewer knows about how many canal in a tooth.
Yes.
You know, I cannot explain well, like 1 canal, 2 canal, 3 canals. But if it's smaller, it's a 3 canals. And if it's in the front tooth, you'll see only 1 canal. Sometimes, you know, there's exception. You know, like 2 canals on the lower also, which is the front tooth. So actually, you can do root canal if it's simple, like maybe front tooth. But if it's the back tooth, it's very difficult to do a one-time procedure because of the complexity, and as well as it's like 3-rooted tooth. Is that what you mean?
Well,
Yeah.
essentially, there's a certain requirements for a given task. The level of complexity clearly affects the amount of time required to perform the task.
Okay.
So in any setting, it may be a different situation given the available resources to perform that procedure. And then also just the experience and things of that sort. So essentially, I think if the focus is made on achieving the highest quality of care, the number of visits becomes secondary, because the goal should be in performing the best quality of the work possible.
Right.
And if it can be achieved in a single visit, great.
Yeah.
And if it cannot be done, then it should take as many visits as it takes to get it done properly. You know, here, and I guess I have in my practice, you know, since 1994, I've done something about 18,000 root canals.
Wow.
So with that number of cases, you know, we've developed systems where we are very efficient in performing the care. So that helps a little bit in terms of being able to perform many of them in a single visit. But as I said, the quality is far more important than the quantity. As a result, any practitioner should do the procedure in as many number of visits as it takes.
Okay.
But as I said, some cases really require it to be done in 2 visits based on the level of infection anyway. So that's something that should be considered.
Yeah, after you do the root canal, you know, like filling the canal, right? That's the last phase for the root canal. Do you indicate to do the filling right away? Because you put like a temporary filling after the root canal. I know the viewer knows that, to those who have the root canal. You know, the dentist did fill the canal, and they put some temporary filling. Do you indicate to cover them right away with a permanent filling?
Yeah,
or you have to wait?
Yeah. Well, most of your viewers who have already had root canals are familiar with the 2 additional steps required following root canal therapy. Root canal therapy essentially removes the infection from the tooth and provides the foundation for the follow-up restoration in the tooth. The restoration is essentially is bringing the tooth back into its functionality, so that it could be used to chew and to work with. Okay. So the first step is to build the tooth up, and the second step is usually to place a crown.
A crown.
So a crown is usually recommended on most of the back teeth behind the eye tooth following root canal therapy. But in many of the teeth in front of the eye tooth, sometimes you can get away with just 1 step after the root canal, which is to fill the opening of the root canal therapy.
Okay. Do you indicate them right away? You have to wait a little more day? You know, even my patient asked me, my procedure, I want to wait. I want to heal. Because if you crown right away and it's become painful again, which is a failure root canal, it's very difficult to open in a crown tooth. How long do you have to wait in order to put the crown after the root canal?
Yeah, well, As I said, since you do need two steps following the root canal, the first step is placing a permanent filling in the tooth, and the second step is the crown.
Right.
The placement of the permanent filling is required within 6 weeks after the root canal is performed.
6 weeks.
6
That's
weeks,
a good
because
one.
the
Yeah.
provisional filling that we place in the tooth following the root canal, it doesn't quite seal the tooth as perfectly as it should beyond 6 weeks.
Yeah,
And there's a higher risk that you can get recontamination of the root canal through saliva and leakage around the temporary filling that we place than waiting until you have full healing of the bony lesion that could take 6 months, a year in many people.
Right, yeah.
So as a result, I think provided that we believe at the time of the root canal that the quality of care was followed and the standards were met, and we're pretty confident about the results, it should be restored right away. There's no reason to wait, because the chances we take by waiting are themselves risks that the patient would be taking.
Okay, so you don't do fill right away permanently after your root canal. You can wait for 6 weeks to do that, right?
Yes, usually.
Because it prevents the leakage so that it will not be reinfected. But tell me, how long it heals after the root canal? I'll tell my patients it takes a year. If there's a lesion, like, on the end of the root, it takes a year. Is that what you said? It takes a year to heal?
Studies have shown that it could take anywhere from 6 months to up to 2 years in some cases.
2
But
years.
that is basically a radiographic appearance. Patients should not have symptoms during this time period. I tell my patients that usually things should be completely back to normal within 1 month.
Okay.
So that symptoms should not really persist for more than a month following root canal therapy.
After a month, meaning when you bite on it, you can bite it freely.
Yes.
There's no pain and no soreness. Then if there's some soreness and pain after a month, something is going on.
The tooth should be evaluated.
Oh, that's
and
good.
usually at
Okay.
that time, a reason should be determined. There are a number of possibilities that could come into account for persistent discomfort after root canal therapy, and those cases could oftentimes be addressed. In a very, very minority of cases, there could be some other physiological reasons that could lead to persistent discomfort, but that really should be kind of evaluated and judged on a given an individual basis.
Oh. Dr. Nasseh, did I pronounce it well?
That's right, you did a great job.
I would like to ask you, what are the latest technology now in dentistry? In my office, I use now rotary endo.
Yes.
I think that's by Dentsply.
There's
several companies, but that's the one I choose.
Yeah.
And there's a lot like, what's the one that instead of doing an X-ray to see the measurement, then you have apex locator. Can you tell to the viewers about the latest technology now? I'll ask you later about the microsurgical, why your business or your office is named microsurgical, because I know micro is microscopy, surgery, of course, surgical. But I would like you to tell the patients about the latest technology now doing endodontic treatment.
No, absolutely. There have been several significant and important advances in endodontic therapy over the past couple of decades. As you mentioned, the use of rotary instruments, which are, in order to do root canal therapy, we're essentially cleaning inside this tiny channel called the root canal using these small files, which could be likened to almost bottle cleaners, which we're brushing and cleaning inside of a tiny channel. This used to be done mostly by hand. However, recently they've become mechanized, and so we could use our instruments to mechanically clean that space, which has increased the efficiency of care. So that's made us a little bit faster, and that's great.
So faster, cleaner, safer. I would say safer because, the files with the little things, I know people knows that, those who had root canal, about the files in the reamer they use. Safer so that, it will not go into the floor of your mouth.
Yeah. At the same time, these files are also more flexible. We're able to treat cases that have more complexity in their anatomy versus the previous hand files that were stainless steel and not quite as flexible. But either way, I mean, besides the technical part of it, the the advances are also the fact that we have electronic apex locators that allow us to find out how long the roots are without exposing patients to multiple radiographs in order to determine that.
So it prevents exposing the people to more radiation or X-rays.
Yes.
It's minimized.
Exactly.
Can you tell me how the people can avoid to have root canal? What are the...
Yeah, I mean, what I usually tell patients is that, you know, the common sense approach, the same thing, you know, you ask a cardiologist, how can I avoid a heart attack, and tell you that, you know, just eat well and exercise. And the same thing applies to endodontics. The way you can avoid, you know, root canals is the same basic common sense approach that we've been told, which is to brush and floss and have a healthy diet, which is low in sugar. Mm-hmm. And, you know, there's some people, however, who have, due to medications that they take or other physiological problems, they may have restrictions in their salivary flow. And a reduced saliva also exposes patients to a higher incidence of caries. Okay. So those are situations that patients have to be aware of, the medications that they're taking and so on. But in general, and for the most part, it still goes back to the
basic,
tried and true
right,
brushing, flossing.
Brass, floss,
is really important.
Yeah, brass, floss.
Yes.
And you know
having
what?
a low sugar diet.
Yeah.
And one other thing to Villanueva is that I tell patients is that one significant factor that creates problems for most of the patients that we see, and I try to explain this to them, is that procrastination is another serious factor in requiring root canal therapy. Oftentimes, when decay is very small, a simple filling would essentially do the job. However, patients, because of the fact that they don't see their general dentists often enough, they don't go for their hygiene visits on regular 6 months.
Yeah,
basis.
the every 6 months visits. Yeah.
You know, they avoid the dentist, whether because of the costs, which is completely acceptable, and the insurance, or fear of the dentist. And as a result, they see the dentist in a few years. And a decay that could have been a very simple, easy, inexpensive procedure is now resulted into a root canal and a core and a crown, which is, you know,
very expensive. And I will add it up to you, implant. Because that's my next question to you. You know, what can you explain to the public, like, why you save the teeth rather than do the implant? I'm sorry about the implant. You know, people knows about implant now. You know, can you tell?
Implants have been a great advance in dentistry over the past, well, implants have been around since the 1960s, but haven't really been in the U.S. really for the until the past really 10 to 15 years for the most part. But implants give us a great opportunity to replace a missing tooth. However, there has been, unfortunately, a little bit of an aggressive campaign to use implants as alternative to root canal therapy, which I think is a little bit, you know, which is a little bit unnecessary, because root canal therapy could save your own tooth, your own organs, your own tissue, and replacing it with an alternative is really good if it has to be done, as opposed to just an equal alternative. So, you know, we wouldn't think twice to save our own, you know, kidney or a finger or other organs. The tooth is an organ, and it should be saved if it can be saved. Now, there are many situations in which, when I see a patient, I would recommend that this particular tooth not be saved and be replaced with an implant.
So you're telling them, if you see, are you talking about if you see, let's say me as a general dentist, I referred you the case, and then after that you see that the decay is so advanced that it reaches up to the below the gum line. Then do you do the root canal, or do you send back to the general dentist and you tell them that I don't think so, this is, you know, indicated for root canal?
Right.
So do you do that? Because if the patient really wants to save the root or the tooth, because it's very important for the patient, you know, to save that tooth.
Exactly. I think the issue you just mentioned, that the patients don't want to save roots. Patients want to save teeth. Patients want to have teeth that they can chew on. So ultimately, we can do root canals on any tooth. as broken down as it is, the root canal can be done. The question is, can the tooth that has had the root canal be restored and placed back into function?
Okay, so
that
meaning
really
it's
is a
very
restorative decision,
yeah.
not so much
Okay.
a root canal decision. Because
Whose
I can do
decision
root
is
canal.
that? Isn't it that from the general
It
dentist
should be-
us?
Yes, it is. It should be
Okay.
a restorative decision
Yeah.
because the person who's going to restore the tooth is ultimately the person who's putting the final touch on the tooth that makes the tooth that the patient can see and chew on. I don't believe that all teeth where the decay goes below the gum line should be removed. Many of those teeth could have
Okay.
a simple procedure that still allows them to save. In
Yeah,
fact,
like
I've had one
crown,
tooth in
like
my own
crown
mouth.
lengthening.
A crown lengthening.
Crown lengthening to the
Yes.
public is like cutting a little bit of the gums in order to increase, you know, the tooth structures that will hold the crown. So, you know, it's up to your decision also, like you want to save or you want to do the implant. The cost of the implant versus the root canal, saving it with crown lengthening and post-in-core are the same. They said the same, but I think more expensive.
Yeah, it is more expensive to have the implant.
So meaning more expensive to do
Right.
the implant,
Yeah.
you know? Okay.
Yeah, but I was going to say, I have had the tooth the same. Actually, I was telling a patient of mine the other day, it was the 20th anniversary of a tooth that I had a crown lengthening post-core and a crown on 2 days ago. And I was joking with a patient telling him that. So I mean, these procedures can last
So-
if done properly.
Yeah.
And if patient is also diligent in terms of taking care of the restoration.
Right, right.
Because you need to still keep on brushing and flossing. Just because you get a crown on a tooth or so on, it doesn't mean that now you have, you know,
So-
pass to
yeah, so-
avoid taking care of that tooth.
Yeah, so you're saying that the success rate is high in
Of
doing
course.
root canal. So it's really
There was
nice
a
to...
recent study in the University of Minnesota that compared the success rate of implants and root canal therapy on individual teeth. And it was completely comparable, if not root canals were slightly higher.
Also, the root canal is higher in success rate than the implant
Right.
if they did right, right?
Exactly.
Okay.
I mean, but don't forget also, even if they're completely the same, we're still talking about preserving your own biological tissue, your own tooth, versus, you know, putting...
Right, yeah,
you know, I
the
mean, I
one
think
that is
there's-
like, yeah.
There's something to be said about keeping your own tissue first. So,
Yeah.
I mean, for me, it has to be a significantly lower success rate to save your own tooth, not to
Okay.
try to save your own tooth.
Tell me about the microsurgical endo. That's the name of your office. You know, can you tell the public the meaning of that microsurgical
Yeah.
endo?
Well, we were talking earlier about the advances in dentistry and in endodontics, especially in and so on. And I think one of the greatest advances has been the advent of microscopic surgery and microsurgical techniques that have been added to endodontic therapy. So that currently we're able to do root canal therapy through an operating microscope, as opposed to using our naked eye vision or even using magnification loops. And what the microsurgical techniques and microscopy is allowing us to do is to have far higher magnification and visualization of the
Higher,
operating
okay.
field.
They can see it much better. You can see it better.
You know, it used to be that endodontics used to be a completely blind procedure because you
Yeah.
could not see anything of what you were doing, and it was primarily a tactile procedure. where
Tactile,
everything-
and then depending on the x-rays.
Yes, exactly.
Right,
So
like
your
measurement to the
eye or your
x-ray,
radiograph.
tactile sensation, oh, and now you got the canal.
Exactly.
But
Now, with the use of the operating microscope, we're capable of seeing so much more, so that the practice has completely changed in that sense, so that the microsurgical techniques are, without a doubt, really improving our ability to explore better inside the tooth, find additional canals, and treat what we have more effectively. And that, I think, has been a very fulfilling part of my personal, professional career in the past 15 years or so.
yeah, that's good. You know, I mean, I don't have that.
Mm-hmm.
I'm not using micro or microscope. As I said to you, for how many years now, since I started my general dentistry, I'm doing a simple root canal. And if it's really hard, then I refer my patient to a specialist to do that. Patients should aware that general dentist fee doing root canal are lower than the specialist. Really, you are expensive.
Well, no, I believe that the fees should be the same, because
Oh,
essentially
really?
you're doing the same procedure. And I think that if the key is having the same standards, because general dentists are held to the same standard of care as specialists.
Yeah.
So if there is no such thing as two different procedures. It's the same procedure, and I believe that you know, the fees. Most general dentists I know, the fees are comparable. I mean, our fees are comparable to the general dentists in the area that are working.
Really, I thought
fees.
that ADA or American Dental Association have the fees for specialists and for a general dentist. Isn't it that so?
No, the ADA doesn't have such thing. Some insurance companies have.
Also, the
such
insurance
policies.
company.
But
you know,
they
that's
allow
their
more,
policy. Okay.
but
All right.
that doesn't mean that either a specialist should charge more or the general dentist should charge less. Ultimately, as I said, it's not so much. I mean, the bottom line is that we're performing the same procedure, and it's the same quality should be essentially maintained throughout the line. In fact, the ADA, you mentioned ADA Brown in 1991. It was a decision that was made and said that the standard of care is set by the specialist, and everybody should be essentially up to the same standard. So, yeah, from that point of view, I believe that we're all doing the same procedure.
Yeah. I think I skipped the question about the conventional and then the surgical, because the patient or the public should know, like a simple root canal or the conventional, and if, you know, can you tell the public the conventional and then the the dentist were going to say, you need a surgical endodontic treatment. And I said, what? You know, what does that mean?
Exactly.
So we have to explain it. So now.
That's a very legitimate question. I mean, the great majority of root canal therapy is the conventional root canal therapy. And it's done usually when a tooth that has been infected for the first time needs to be treated endodontically. So essentially, the general dentist or the endodontist will get inside the tooth and clean up the root canal space, disinfect it fully, and fill it with a root canal filling material, and that's a conventional root canal. And 95% of the time, that is the end of the of the procedure, and it's all done. Occasionally, at different points, depending on the degree of infection, some people wait unfortunately too long and they have a huge infection in the tooth.
Okay.
A conventional root canal only addresses the infection that's inside the root.
Okay, but
the
not
infection
outside.
that's outside the root kind of is addressed with the immune system and the antibiotic that the patient takes. In 5% of the population, cleaning the inside of the tooth and doing a root canal is not enough to address the infection outside. And if the infection persists outside the tooth following a conventional root canal therapy, then a surgical root canal is needed, in which the endodontist or the oral surgeon essentially will access that area and surgically and essentially clean out the infection and essentially place a plug at the very end of the root so that it can be sealed and cleaned completely.
How long you have to wait to do the surgical? You said you clean the canal inside, you remove the infection, but then when do you indicate that you need that surgical root canal?
Yes.
Do you have to wait until it becomes symptoms again?
Well, if everything is healing well, you are monitoring the area and you just simply are watching it. As I said, up until the first month after the root canal, you're monitoring the area.
Okay.
But if things are not improving, are getting worse,
then you
or
have
if the
to
patient having persistent symptoms in the area, then a surgical approach and curettage of the end of the root might be needed.
Oh,
but that's the minority of cases.
Okay.
I think a great lesson to kind of emphasize in that area is that one thing has become clear over the past 50 years in endodontics, and it's that root canal therapy in severely infected teeth have a slightly lower success rate than teeth that are just becoming infected or are just before they become infected. So it's very important to avoid infection at all costs, to be able to get the highest success rate and the least amount of complications. This is where that procrastination that we were talking about comes in again. So waiting too long until you have a large infection can be deleterious, not only to the outcome, but also to your experience post-operatively and so on. So it's very important to be able to be proactive when it comes to root canal therapy and understand that a tooth that will eventually need root canal therapy should have it done before it gets infected in order to have the most pleasant experience and the least complications post-operatively and the highest success rate, than to let's wait and see approach and then do it when they have a lot of pain and swelling.
Right. Do you believe in a calcified canals? To the viewers, calcified means there's no line on the x-ray, that when you do the x-ray you cannot see the line or the canal, and it's calcified. What do you do in the calcified cases?
Well, essentially, to explain what it is a root is formed from outside in. The root canal is the remnant of that original outside information of the root. So this remaining canal, at times due to chronic irritation, still continues to get narrower and narrower. And that's the process of calcification. When a narrow canal, a root canal is generally the thickness of a human hair. It's quite a thin space that we're working in, and that's why it's such a delicate procedure. But at times, even that hair width or hair diameter becomes even thinner. And getting through that space becomes more difficult. There have been some advances in terms of using some instruments, as well as some chemical, some chelating agents such as EDTA and so on, to remove some of that calcium slightly.
So really, you really want to go into the canal.
Yes.
You don't leave it. But let's say if you cannot really see it.
Well,
so you leave it alone?
That's where the microscope comes in. I mean, the
oh,
microscope
no,
really
that's a microscope,
helps.
right?
Yeah,
okay,
the microscope
all right.
helps us quite a bit in finding these such calcified canals. But you know, depends on the symptoms and when you have a calcification. If somebody has symptoms on a calcified tooth, then or if there is an infection there, chances are there will probably remain an infection if we just leave it alone. So therefore, something has to be done about it.
Yeah.
But if there are no symptoms.
Yeah, Dr. Nasseh, I think we're almost done, but I would like to ask you about, like, for children or child who had a discolored tooth on the front because they got trauma, you know, injury, and the tooth on the front become discolored. What do you do? Do you do root canal on the primary tooth or baby tooth?
Well, as you said, it depends on the dark tooth, if it is a deciduous tooth or if it is a permanent tooth.
I'm talking about deciduous, yeah, baby tooth.
Yeah, there is a little bit of a conflicting opinion among pedodontists that I have spoken to, and some endodontists. Some pedodontists believe that maybe it should be removed and a space maintainer should be placed. Endodontic therapy can be performed on those teeth when, if done properly, they should be fine. It could be maintained. It all depends as to the amount of mobility, the age of the child, and when the permanent tooth.
Let's say it's a 5-year-old boy or girl and become discolored, intact tooth, not mobile. So do you do root canal or you just don't do nothing and watch?
I would probably say you would be safer to do something, because there are many instances, if you have a chronic infection associated with a deciduous tooth, that the remaining abscess at the root end could potentially damage or cause a staining on the enamel of the succedaneous
of
tooth.
the erupting permanent
Exactly,
teeth,
permanent
you know,
tooth.
because I see some of the specialists. I have a grandson, and as I said, I do root canal. But then when my grandson happened to have a black tooth, I told my daughter, bring to another dentist or to specialist and see what they're gonna do. And the dentist or the specialist said, do nothing. And I said, okay, because I know if I'll be the one to do it, there's a word calcium hydroxide. I open the canal and I put the calcium hydroxide to prevent more infection. Why I'm waiting to develop the infection in there? I can put something. But the thing is, it's hard for me to treat my own, you know? So anyway, so what do you think about that?
Well, in many cases, I think that's really important, the issue of second opinion, because just, you know, it seems like you may get different opinions on that matter if you go to different people.
Okay.
And I probably would agree with you that probably placing calcium hydroxide would be a better
open the tooth. And then, do you irrigate them?
Yes.
Do you still?
Yeah, of course.
People knows that if they have root canal, there's some irrigation. You know, I cannot say what is that, but it's endodontic irrigation that we use to kill the disinfectant to kill the bacteria there. And then we put that calcium hydroxide, which is the medicine, in there in order to prevent more infection. And then you cover it again with the permanent filling.
Yes.
Right, yeah. Dr. Nasseh, this is my last question to you.
All right.
You know, that I hope the public, Dr. Nasseh, helps so much for you. I know it's not, I hope it's not a boring to you, because this is a very, very important one. Even myself, as a general dentist, is, you know, I know I learned it from the school, but it's so nice for me to listen to the specialist also. I learned a lot today from him also. Even I knew it already. I just want you to know it. That's why I keep on asking for it, you know. And Dr. Nasseh, did I pronounce it Dr. Nasseh? Don't forget, I have my accent also, you know. This is the best question. why did you choose to become an endodontist? You know, from general dentist, I don't know if the viewer knows that before you become a specialist or an endodontist, you have to finish the 4-year college like what I did. Then go back again to school in order to be a specialist. Why did you choose to become an endodontist? You know, why not other field?
Yeah.
Because?
A single question. I mean, well, first of all, my particular situation, why I became a dentist even, is my father's an oral surgeon. I grew up in this in the field of dentistry, and that's what I was always destined to do. I never thought of anything else. When I became an endodontist.
Sorry, did your parents push you to be a dentist? Or is
Maybe
it your liking?
subconsciously or something, but I really wanted to do it. Maybe early on in the career, they may have told me subconsciously, but no, it definitely wasn't by force. I mean, nobody twisted my arm.
I'm trying to push my kids.
Are you?
I have 4 kids.
The best way is to plant a seed, little by little.
I am planting, you know, I'm planting, but the thing is, I don't know, I hope I will have one that will become a dentist who will take over my practice and do a good dentistry like what I'm trying to do, you know, to the people. And I'm doing this one to help the people also to understand the phases of dentistry. Phases means all multi-specialty, you know. And, you know, Dr. Nasseh, this is a great honor for me. And I thank you so much, you know, for letting me to come into your office. And to the viewers, you know, I'm so, you know, happy that I hope you stayed so long, or maybe you tape it so that you know the meaning of endodontics. And I am hoping that I am going to see you again on my next show. Have a nice day.
Thank you for having me.
Mm-hmm.